So, again, this avoid to press the trachea and you go like this. Now we move to the next one, antethorax. In a woman, antethorax is, we have to do like this because we have to look. Check the ribs cage. Okay? We check the rectus sheath. We are in a space between xiphoid process, okay, mid-clavicular line, which in a male is the line of the nipple, more or less. Okay? In the middle of the two, we have the point. So more or less is where? It's where the rectus sheath insert and join the pectoralis over the ribs, over the last ribs. So you have to, I'm over the ribs. In this case, you need to ask her to, with one hand to lift a little bit here. Yes, put a hand like this, and the point is here. So we are over the ribs cage, in the middle between the xiphoid process and the mid-clavicular line, in the middle. So in the insertion of the rectus over the ribs, where also we have, if you remember the anatomy picture, this is where we have the joint of the pectoralis fascia with the rectus sheath, the fascia of the rectus abdominis. And here it looks like this.
1 minute is dangerous.
This point, for what is important? For upper thoracic pain, most of the time the patient is in pain posterior, okay, posterior part. For internal dysfunction, gastritis, gastrointestinal reflux.
La linea da cardio, no?
Sì. And also, then, for shoulder pain, because if you have densification, you will have limitation of flexion. Look like this. If this is densified, when I lift, so for shoulder pain is very important this point. Very, very important. Neck pain, especially felt at around the occipital bone, because when you have especially bilateral densification, patients start to have pain here. Very important after breast surgery, maybe for breast augmentation, but also for like cancer. It's very useful to treat it. Costochondritis, the inflammation of the rib cage. And for shoulder, yes. Okay. The treatment, you can go with the knuckle or also with the elbow. If you go with the elbow, we see after the elbow, you use usually the flat portion, so the part of the ulna, this part here. And this other one only for the glutes usually. Okay? So in the flat portion, you stabilize yourself. Rest your hand. Stabilize. But I use shifting thing because this point is positive, but the pressure is very little. Just the pressure to reach the point, then I have to keep reflection.
And do you feel
I
the
felt
crunchies
pain
in
all
there
the
too?
points.
Yes. This line is positive.
In the body, Chinese body reflexology, we use a lot this point also relation with the psoas mass.
Yes. For decrease, even for low back pain.
It's very, very
specific.
Yeah, important point.
Now, what happens is interesting. She doesn't have spontaneous pain, but some of the points are positive. So now we are just palpating. The idea is that to do an assessment of the patient first, to know what's going on. And most of the time you will see that the pain is upper somewhere. The most important points are in segment far away of the patient. Okay? Now we move to the next point. Anton, can you just lower a little bit here? And below we are basically at the level in the rectus sheath.